It's quite a revolution in a very short period of time, really quite an extraordinary transformation. I think everyone is anxious about the nature of this disease.
Construction is at breakneck speed as hospitals prepare for the coronavirus to hit its peak.
We have a window of opportunity to prepare and train for the potential large surge of patients arriving.
And we're waiting for CO2, continue ventilation and secure the tube.
We have 50 ICU beds. We're working on expanding that in the order of 150 to 200 ICU beds if we need to.
But an improvement of oxygen levels.
Melbourne's Monash Health has overhauled its hospitals since it first treated Australia's patient zero.
25th of January, just before Australia Day, we received the very first person who had been diagnosed with COVID-19, and since that time the health service has been preparing. Weeks are days and days are hours and hours are minutes. We don't want to waste any time. Good morning. Update us on our activity.
We have 5 patients with positive COVID-19. 3 are at Clayton, 1 in ICU.
We look at logistics in terms of equipment, the flow of PPE.
Before the COVID crisis, there were more than 2,000 beds in intensive care units across Australia, nearly all occupied on a regular day. The federal government is planning to more than triple that capacity.
We have been preparing for around about 5,000 patients in intensive care on the worst day. At the moment, with the curve as it is and with the numbers as it is, we have done an exceptional job to contain the epidemic. But we have to be cautious because the ongoing community transmission could push up those numbers.
Each patient in ICU requires 1 nurse at all times, so with the plan to triple the number of beds, Australia also needs to triple the ICU workforce.
We're looking at 35,000 nurses to actually manage that. There's certainly a lot more to train.
I'm checking allergies, whether the patient has any medical allergies or drug contraindications, not that we know of.
Neonatal nurse Anna Kidman was one of the first to volunteer to move to ICU.
I was a bit apprehensive to start with. I've done it before, but it was, about 7 years ago.
To get ready, Anna's thrown into a simulation of how to safely put a tube down the throat of a COVID-19 patient who can't breathe and connect it to a ventilator.
If you've been out of the games, that it would be really daunting coming back, but I think reinforcing how vital basic nursing skills are, how transferable skills are.
The patient looks comfortable. Everyone happy?
Each new ICU bed needs a new ventilator. 730 was granted exclusive access to the national stockpile of medical supplies at a warehouse in a secret location where imported ventilators are trickling in. Australia needs thousands more ventilators.
The offshore procurement of ventilators, it's not a reliable supply line. As you can imagine, the 2 of the world's biggest economies have been the hardest hit by this virus. So getting a ventilator imported at the moment is a very challenging matter indeed.
The nation's brightest minds are finding creative solutions.
Internationally, there are hotspots for the epidemic and the demand for ventilators is exceeding their local supply.
Australia's chief scientist, Alan Finkel, is on a federal government task force that's trying to find thousands of new ventilators by winter. But we're losing out in a global bidding war.
But we have had at least one case that I'm aware of where we had a line of sight to a few hundred very, very legitimate ventilators from a major international company, and somehow they disappeared from the warehouse before our trucks arrived to pick them up, to take them to the airport, to bring them to Australia. It's a little bit like what you've seen in hoarding in supermarkets in Australia happening at a national level.
So we're moving at maximum speed possible.
Australia's medical industry is rallying in response.
Australia is on a war footing, and the medical technology industry is on the front line in terms of bringing competing companies together and sharing information around supply, sharing designs even in terms of proprietary information that was previously commercial in confidence. These are the measures that have been taken to ensure that every opportunity is taken to maximise and increase that supply. And it's extraordinary times.
If there's a global shortage and people are shutting their borders to equipment that's vitally needed for us as Australians, we need to find another way.
At this factory in inner Melbourne, a homegrown ventilator industry is taking shape.
This is the beauty of the 3D printing in the medical supply chain, is that we can very quickly get up and running.
Less than a month ago, 3D Meditech mostly made dental devices and children's orthopaedics.
Initially, it was incredibly daunting to be pivoting the business. When you come into our site, it's gowns, gloves, masks, disinfectant. Obviously, we're cleaning hourly. We started off making a spacer for hazmat suits, which we produced in 48 hours. We've now done face shields for hospitals. We're now almost at a clinical trial for medical swabs.
3D Meditech is developing ventilator parts in coordination with the National Task Force. Each machine requires hundreds of parts, so competing companies are now working together.
We've now got 2,500 invasive ventilators on order being manufactured by 2 Australian companies. We've got a specification out there that is enabling a number of Australian companies to put their foot forward and to join the effort to produce ventilators.
The public's cooperation has bought frontline medical staff precious time, which until now has been in short supply.
I'm cautiously optimistic that we're going to get through this together, and I just hope that everyone is listening to the advice that we've been given and being sensible, and we will be able to get through this.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.